Hi, everyone. I'm Sergio Carmona. I'm the Chief Medical Officer at FIND in Geneva. And to mark the Global Week for Action on NCDs, we have developed a series of videos to explore many aspects of how diagnostics are critical to achieve the targets for the control of diabetes and cervical cancer. And to that effect, we also want to mark the launch of the new FIND strategy on NCDs. So, Bente, let me take this opportunity to introduce you to our audience.
Hi, Sergio, and congratulations with this initiative to have a series of videos. And of course, we are thrilled that you now mark the launch of FIND's new NCD program. And as both of us know, 74% of all global deaths every year is due to NCD. So we have a huge job together to do. And by the way, I'm Bente Mikkelsen, so I'm the NCD director based in Geneva at WHO. Really looking forward. So maybe, I don't know, I think I'm not the only one curious about what the new NCD program in FIND is. So maybe you want to tell us a little bit about that.
So, thanks, Bente. FIND is, as you know, one of the WHO collaborating centers that is focusing on diagnostics for diseases that are neglected or in settings where access is limited, or both. So our mission is focused or aims to achieve equitable access to reliable diagnosis worldwide. And we connect countries, communities, funders, decision makers, as well as healthcare workers and providers to ensure that the test developers are also spurred to ensure that their innovations are fit for purpose and make testing an integral part of a sustainable and resilient health system. Our strategy recognizes that diagnosis and management go together for NCDs and requires a patient-centered approach. In other words, brings these diagnostic solutions closer to people that need them. Again, I would like to stress that we're focusing on primary healthcare workers in low and middle income countries. And to do that, we continue working with these communities very closely. We also need to ensure that we work closely with manufacturers to identify and address key barriers to achieving access of these tools. So, in essence, the NCD program at FIND rests on three pillars. The first one is access, and that is, by driving affordable NCD diagnostic tools. Two, technology and development to build a portfolio of fit-for-purpose NCD tools through evaluation and R&D guidance. And the third pillar is care models. So test and implement delivery models for screening, linkage to care of chronic disease management, as well as education.
Yeah, thank you, Sergio, and this is really impressive. And this for me is just another example how important partnership is. As you probably know, this year's World Health Assembly had, I think, the biggest NCD agenda ever. And the reason, unfortunately, is that so many years into the agenda. The first time we had the political declaration was in 2011. We had one in 14 and 18. We only have 14 countries that actually are about to reduce premature mortality with 30% before 2030. So, of course, my focus in my daily life is really to support the implementation roadmap. And the implementation roadmap is really about, again, to achieve access to healthcare and in that also access to medicines and devices for people living both with cardiovascular diseases, which is the most deadly disease, but also cancer, diabetes, which unfortunately is the one that are increasing most when it comes to dying too young, what we call premature mortality, but also chronic respiratory diseases. So this comes out very timely, Sergio. Thank you very much for laying this out for us.
So Bente, considering that diabetes is one of the primary priorities of WHO NCDs, earlier this year, the first ever global coverage targets for diabetes were adopted, as you said, at the 75th World Health Assembly. So, what role does WHO see for diagnostics in achieving these pretty ambitious targets? I'm eager to hear from you on that.
Yeah, no, thank you. And again, at the same time that we got the decision by the World Health Assembly and the member states on an implementation roadmap, we exactly got also the coverage targets for diabetes. And I'm very happy about that because, 100 years after the discovery of insulin, only half of those who are in need actually can access it. So we are very encouraged by the momentum that was built both through this and also our launch of the Global Diabetes Compact. So I think all of our listeners know that diabetes is a chronic condition which actually requires regular access both to diagnostics and to medicines. Unless you monitor, and you have to do it actually self-monitoring ideally and at the primary health care, it is not enough to give access to insulin. So what we can see is that the appropriate use of insulin and diabetes medicines hinge actually on the access to affordable medical devices, both for safe administration, but also including optimal glucose monitoring to guide insulin. When we look at the world as it is today, we see that devices are not always available and are very often, unfortunately, unaffordable to patients. So when we work with the people living with diabetes as part of our compact, we have been very, very clearly advised by them that we need to think of these things together and we need to make them both available at a high quality and affordable, both for patients, clinicians, and at all levels in the health care system, and of course, especially in the low resource setting. So also research underpin this that if you have self-monitoring of blood glucoses, then you actually have a completely different outcome for the people living with especially type 1 diabetes, of course.
And Bente, they're not too dissimilar to what we've learned during COVID or the many years that FINE has worked on other infectious diseases. So things that resonate with what you've just said is access, affordability. What's the point of having a diagnostic tool that is not coupled with the treatment? And also the opportunities that exist already through a health system that has been put in place in some countries and needs to be strengthened to achieve our universal health coverage. So on access, bringing testing closer to patients and communities has been key, especially during COVID, as many of you may know. The other thing we've learned for many years from my experience in HIV is that there are opportunities within the trajectory of a patient because they access health systems to then broaden the repertoire of what you can offer. Antenatal care today in many countries where HIV is high burden is coupled with an HIV test or syphilis. That reminds me that also if a woman is already HIV positive, ensuring that she has access to early diagnosis to prevent cervical cancer, it's also another opportunity. We know during COVID, those with comorbidities, that not testing for high blood pressure or diabetes was a missed opportunity because the outcomes were certainly better if we had that early diagnosed and managed. And well, needless to say, empowering our healthcare workers with knowledge and the tools is not only for infectious diseases, but also for NCDs.
And I think what you're saying is extremely important because this is exactly what we have tried to do to learn from HIV. So you were mentioning the targets, and if we look at the targets for example, diabetes now, and we also have very clear targets for cervical cancer. But if we use again the example of diabetes, 3 of the 5 adopted targets actually has a need to increase the access to measurement for blood glucoses and HbA1c. So it's not even a question. We cannot only focus on one thing. We have to focus on both. And I'm also very happy that you mentioned comorbidities. I think we saw during COVID that it was the people living with NCDs, namely especially cardiovascular hypertension, but also cancer and diabetes. They were dying from COVID. So I think you were mentioning cervical cancer and HIV, but I think we should also focus on TB and diabetes. There is a clear link. So I think if the two organizations of ours, through our scope, also can push for the focus on comorbidities and also the point of care, and utilize, the very sort of scarce healthcare workers at that point, it would also be very, very helpful to reach the targets as we see them.
So, Bente, as you know, and the many discussions the two of us have had, FIND is very much focused on primary healthcare and tests or diagnostics that are fit for purpose at that level of care. So, quality is key to ensure that we have a really safe result for patients at that level. What is your program or WHO more broadly working on to ensure that fit for purpose diagnostics are available at PHC level and of good quality?
Well, thank you. Thank you for that question, Sergio. And I think also we need to be very clear that most key documents state that improving access to health products is really a multi-dimensional challenge. And it requires action across and adequate knowledge of the entire value chain and life circle, from research and development to quality assurance, regulatory capacity, supply chain management, and use. And we have, as WHO over the years, developed numerous tools and resources to support countries in their efforts to identify, select, procure, and manage health technologies, including guiding medical equipment by healthcare facility. So I'm proud to say that I think we have a good framework. And of course, I think everybody knows also the WHO list of priority medical devices, and it's now updated annually and guide countries in understanding what technologies that are available under development and suitable for prevention, diagnosis, and treatment. I'm very happy that we in WHO have several departments within the medicines and health product division that do different things. So we have pre-qualifications, as you said, and now we are in a process towards pre-qualifying blood glucose monitoring and HbA1c. So I think it's very important that we focus on, as you said, the quality on the whole series, the whole value chain. And I think again, if I use diabetes as an example, it is from the evaluation of glucose meters to the test strips and HbA1cs.
And Bente, for the audience that may be less technical, like people living with diabetes and needing to inject insulin daily, what is the simple message for them? Is it like, clearly WHO is looking at both devices and diagnostics that are of good quality and fit for purpose at that level of care. Is that a correct reflection in simple words?
Absolutely. And, this is one of the big breakthroughs, which again we learned from HIV, is that we now have the community of people living with diabetes as we have for cancer, and also will set up for people with hypertension that guide us. And they are very, very clear. We cannot have access to medicines without self monitoring, and it has to be at high quality level, and it has to be also with the support of educated healthcare personnel, and also with the focus on health literacy for the patients themselves. We have talked about quality devices and medicines, Sergio, but unfortunately, in many places, first of all, we don't have we don't have the devices for self-monitoring. We don't have access to insulin, and it is a cost perspective to this. And that's what the Global Diabetes Compact is about. We need to include this into the universal health coverage. It should be a natural, coverage for people. But I understand that FINE's new strategy will also help when it comes to support the affordability. So maybe you could say something more about that.
Many of my colleagues that are working in low and middle income countries keep on reminding us that the primary barrier to access sometimes often is price. And so in that regard, FIND is working closely with manufacturers to have negotiated access prices for low income countries. And we also work with manufacturers to look into innovative ways to reducing the cost of goods to produce them or distribute them, and also have clear understanding what the possible countries, buyers, etc., volumes could be like to incentivize them to produce products for that particular market and geography. So it's part of what we do for other programs at FIND, and certainly we are already working on it for diabetes.
Thank you very much, Sergio. And I think this is very important for our audience to know as well, because I think it's the first time where the diabetes community have gained the hope that there will be a change, and they see collaboration between WHO and FIND as one of the positive pointers. So thank you very much. And I hope we can extend this also to hypertension devices, as you have done also for cancers. So the future is bright for our collaboration, I think.
This has been a really interesting conversation with you, Bente. And I think from our audience, just to maybe bring it all together, I would say FIND together with WHO, many of our partners are stronger today. And we will take your message very clear. One, we need to invest. We need to invest to protect our patients. We know that early diagnosis is a cost-effective measure rather than treating those with advanced disease. The link between NCDs and infectious diseases couldn't be clearer today after COVID, and also through other epidemics that remain under poor control like TB. The link between HIV and cervical cancer is clear. And the last, as you said, right, good quality tests go hand in hand with good ideas, and how we implement them requires still some research. And you can take it from me, FIND will definitely commit to NCDs, and I hope to have a follow-up conversation with you to tell you how we're doing. Thanks for your time, Bente.
Thank you very much, and I look forward to this excellent collaboration. We can only manage this together, I think. Thank you so much.
Great. Cheers.